Today, we will take a closer look at the diseases that are relevant to all dermapigmentation professionals. These are the diseases that artists can potentially come in contact with. Dermapigmentation professionals refer to PMU, microblading, SMP, body tattooing, and paramedical artists. The reason I created this section is because I know that in many parts of our country and many parts of the world, the dermapigmentation industry is not regulated. So, I propose that we take the responsibility for our own health and the health of our clients into our own hands by educating ourselves about bloodborne and communicable diseases and taking preventative measures. Being a dermapigmentation professional, employing your artistic skill to bring people joy, can be fun and rewarding in many ways, but it is also a great responsibility for you, your clients, and their health. One careless action during the procedure can lead to the transmission of a potentially life-threatening infection from a client to you, or from one client to the next. Some of your clients may be infected with a communicable and fatal infection and not even know it. Fortunately, there are easy preventative measures that, if followed, will keep you and your customers safe. In order to understand the principles of infection transmission, we first have to understand what types of microorganisms may cause an infection. There are 4 types of microorganisms: viruses, fungi, bacteria, and parasites. Today, I will examine more closely all 4 classes of microorganisms and the diseases that they can cause. The first type of microorganism is a virus. A virus is one of the smallest, submicroscopic, non-cellular structures that live on our planet. Non-cellular means that viruses don't have their own cell. They use a host cell to live and to reproduce. Viruses are so small that they can only be seen by the most powerful microscopes. They are very hard to kill and are not affected by antibiotics. There are many vaccines available nowadays to prevent them, but even with the modern medicine we have today, there are still viruses that cannot be cured and can be fatal. Many viruses can cause common colds, respiratory infections, and gastrointestinal infections. These viruses are airborne and easily transmitted by being around the sick person. If you or your client have any symptoms of common viruses such as fever, body aches, difficulty breathing, stomach ache, or any other symptom, do not perform services. Instead, look for help from a healthcare provider or refer your client to see a healthcare provider and reschedule the services for a later date after the infection is completely cleared. The most common virus that we, as artists, can come in contact with is the herpes simplex virus. Herpes simplex virus is categorized into 2 types, HSV1 and HSV2. HSV1, commonly known as fever blister, is mainly transmitted through oral-to-oral contact and can produce cold sores in the lip area. If your client has an outbreak of the virus in the lip area, do not perform the procedure. Instead, ask your client to see a healthcare provider for treatment. After the outbreak is cleared, the client can come back for a procedure, but they must be on antiviral medication while having the procedure done. To prevent an outbreak, all clients that have HSV1 must start antiviral medication treatment before having a lip dermapigmentation procedure. The other type of herpes virus is herpes simplex 2. HSV2 is a sexually transmitted infection that causes genital herpes. As dermapigmentation professionals, we do not work with HSV2 virus. Another type of virus that we can encounter as professionals is hepatitis. Hepatitis is an inflammation of the liver that can cause damage and can be fatal. There are 5 main types of hepatitis A, B, C, D, and E. All 5 types are from the same family and all cause liver damage, but each has a different way of transmission and a different severity of illness. All 5 types of hepatitis virus can have very severe symptoms or no symptoms at all. Hepatitis A and E are commonly transmitted through contaminated food and water, and they are not as prevalent to dermapigmentation professionals. Hepatitis B is the one that you do need to know about. Hepatitis B, also called HBV, is a serious and potentially life-threatening infection. It is bloodborne, which means it's transmitted through exposure to the blood and body fluids such as saliva. Common methods of infections are from reuse or from inadequate sterilization of equipment and needles through unsafe sex and needlestick injuries of healthcare workers or dermapigmentation professionals. Most people do not have any symptoms when recently infected. Hepatitis B. Common symptoms are yellowing of the skin and white parts of the eyes, dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. Hepatitis B is not spread through casual contact like food, shaking hands, or hugging. Hepatitis B virus is a major global health problem. It can cause chronic infection that puts people at risk of death from cirrhosis and liver cancer. There is no treatment for acute hepatitis B, only care to maintain comfort. Hepatitis B can live on surfaces outside the human body for at least 7 days and is the most difficult one to kill. Make sure to check the label of the disinfectants you use. They must be effective against hepatitis B, and clearly state that on the label. One good thing here is that there is a vaccine available to prevent hepatitis B. U.S. health authorities recommend a vaccine for hepatitis B for all professionals with direct contact to the public, including dermapigmentation professionals. The vaccine for hepatitis B will also prevent you from acquiring hepatitis D because hepatitis D is a co-infection of hepatitis B. Someone can get Hep D only if they already have hepatitis B. Hepatitis D is bloodborne and is considered the most severe form of chronic types of hepatitis because it rapidly leads to cancer and liver-related death. Another important type of hepatitis you need to know about is hepatitis C virus. Hepatitis C is also a bloodborne virus, and it causes acute and chronic infection. Acute infections are about 30% of all cases and are usually asymptomatic and do not lead to life-threatening disease. The remaining 70% of those infected with Hep C will develop a chronic HCV infection, which may lead to liver cirrhosis and can lead to death. Common transmission happens through reuse or inadequate sterilization of needles and equipment, unscreened blood transfusions, sharing of needles during drug use, infected mother to her child, and during sexual contact. Hep C is not spread through casual contact, shaking hands, hugging, kissing, or sharing food with an infected person. Usually new HCV infections are asymptomatic unless they develop into the chronic form. Many people may not know they have an HCV infection, so it is important to treat every client as if they may be infected with this disease. Currently, there is no vaccine available for hepatitis C. There is an antiviral medication available to treat hepatitis C, and it can cure more than 95% of people who are infected with this disease, but the problem is that there is a very limited access to this treatment. The treatment was developed in 2014 and can cure more than 95% of people in just 8 to 12 weeks. The next virus that artists can come in contact with is human immunodeficiency virus, also known as HIV. HIV breaks down the immune system and weakens the body's defense against many infections and some types of cancer. The virus impairs the immune system and infected individuals slowly become immunodeficient. The most advanced stage of HIV is immunodeficiency syndrome, also called AIDS. AIDS is defined by severe health problems such as certain cancers and severe infections. HIV can be asymptomatic, and someone can be infected for years without even knowing it. The testing can determine whether the person is HIV positive only 6 months after the exposure to the virus. HIV spreads through body fluids such as blood, semen, and vaginal secretions. Currently, there is no cure for HIV infection. Remember that your client may not tell you or may not know that they are HIV positive. If you use a tool on a client, and the tool is contaminated with bodily fluids and you use it on another client without proper cleaning and disinfection, you may transmit the infection. There are many other viruses such as human papillomavirus, HPV, smallpox, chickenpox, rabies, yellow fever, polio, influenza, and many others that I did not discuss in today's lesson. They all have their own ways of transmission and cause different symptoms, but all can cause damage to the human body. So this is why it is so important that you do proper cleaning and disinfecting. I will talk about how to do proper cleaning and disinfection in my next lesson. Fungi are microscopic plant structures that can produce contagious diseases. Most fungi are non-pathogenic and are a part of the body's normal flora. Fungal infections commonly affect skin, nails, and hair, and are caused by dermatophytes as they live off keratin. Keratin is the protein that makes up the skin. Most common diseases caused by fungal infections are onychomycosis, infection of the nail, Tinea pedis, also called athlete's foot, infection of the foot, Tinea versicolor, discolored patches commonly found on the legs and arms, and others. They are all transmitted through everything that touches the infected client's skin, tools, surfaces, towels, doorknobs, etc. Make sure to clean and disinfect all the surfaces that were in contact with the client's skin after each client's session. It is always good to assume that all clients may have an infection. If your client has a fungal infection in the area of dermapigmentation, refer your client to a physician for treatment, and advise them to have your service once it's all cleared. Most common diseases caused by fungal infections are onychomycosis, infection of the nail, Tinea pedis, also called athlete's foot, infection of the foot, Tinea versicolor, discolored patches commonly found on the legs and arms, and others. They're all transmitted through everything that touches the infected client's skin, tools, surfaces, towels, doorknobs, etc. Make sure to clean and disinfect all the surfaces that were in contact with the client's skin after each client's session. It is always good to assume that all clients may have an infection. The next type of microorganisms that I will talk about is bacteria. Bacteria are single-celled microorganisms that live almost everywhere, on all surfaces, in and on the human body, in the air, in the soil, and water. Bacteria have two phases of life, the active phase and the spore-forming phase. Usually bacteria actively grow and reproduce when they are in favorable conditions, and that is called an active stage. When bacteria come to unfavorable conditions such as unsustainable temperatures, lack of food and water, they go into an inactive stage, which is called the spore-forming stage. In this spore stage, bacteria will wait until conditions change to come back to the active stage again. When bacteria are in the spore stage, it is very hard to kill and they are not harmed by disinfectants, heat, or cold. There are thousands of different types of bacteria and all are divided into two types, pathogenic and non-pathogenic. Non-pathogenic bacteria are harmless or sometimes even helpful. They live in the human body helping in many ways including protection against infection, or they can live as a part of some foods like yogurt, kimchi, or kombucha. Pathogenic bacteria are harmful to the human body and can cause disease or infection. Pathogenic bacteria are classified as Cocci, Staphylococci, Streptococci, Diplococci, Bacilli, and Spirilla. Each type of pathogenic bacteria produces its own group of bacterial diseases. For example, Staphylococci cause staph infection, Streptococci, strep throat and blood poisoning, Diplococci cause pneumonia, Bacilli, tuberculosis, diphtheria, typhoid fever, and tetanus. Spirilla causes Lyme disease and syphilis. Bacterial diseases are commonly treated by antibiotics. But some bacterial infections are becoming highly resistant to antibiotics and are very difficult to treat. As a result, they can become systemic and result in death. Some people can be infected with bacterial disease and not even know it. Look completely healthy, go about their business and spread the disease to others. Bacterial infections can be local, infecting only some parts of the human body or some tissues, or they can be systemic, infecting the entire body. Signs of local infection, tissue inflammation, redness, swelling, heat, pain, or presence of pus. Most common signs of systemic infection are coughing, sneezing, vomiting, diarrhea, and fatigue. If your client has any signs of local bacterial infection in the area of dermapigmentation, or signs of systemic infection, do not perform the procedure, instead refer your client to see a physician. Ask your client to come back after the infection is fully cleared. Bacterial infections can be local, infecting only some parts of the human body or some tissues, or they can be systemic, infecting the entire body. Signs of local infection include tissue inflammation, redness, swelling, heat, pain, or the presence of pus. The most common signs of systemic infection are coughing, sneezing, vomiting, diarrhea, and fatigue. If your client has any signs of local bacterial infection in the area of dermapigmentation, or signs of systemic infection, do not perform the procedure. Instead, refer your client to see a physician. Ask your client to come back after the infection is fully cleared. The most common bacterial infections are caused by Staphylococci and are carried by a third of the population. Staphylococci are responsible for food poisoning, MRSA, and a wide range of other diseases, some of which can be very aggressive and cause death. Some staph infections are highly resistant to antibiotics. In dermapigmentation clinics, staph can be spread through unclean tools and all surfaces that come in contact with clients. Tuberculosis is a bacterial infection that you should know about. Tuberculosis is caused by Mycobacterium and affects the lungs. The symptoms are chest pains, fever, night sweats, weight loss, and a cough with blood. TB is spread through the air when people with TB cough, sneeze, or spit. Only a small amount of germs are required to cause an infection. TB is preventable and curable. In order to cure this infection, it takes a 6-month course of 4 types of antibiotics. People with HIV are 18 times more likely to develop TB, and if that becomes the case, the combination is lethal. Common transfer of bacterial infections is through body fluids that are left on the surfaces like doorknobs, equipment, and towels, as well as through direct contact such as coughing, sneezing, talking, shaking hands. Some clients can have an infection but may not show any visual signs, and that is why the disinfecting rules to maintain spread of pathogenic microorganisms are so important. The last type of microorganism that I will talk about today is parasites. Parasites are small organisms that shelter, feed, grow, and reproduce on or in another organism, while not supporting the survival needs of that organism. Unlike other small organisms, parasites must have a host organism to survive. There are 3 main classes of parasites in humans that can cause a disease: helminths and protozoa. Humans can acquire internal parasites by eating not properly cooked fish or meat, by being in contact with the carrier of the infection, or by touching contaminated surfaces. Remember, micropigmentation professionals are not allowed to treat or recommend treatments for any diseases. Instead, they must refer the client to a physician. Parasites are small organisms that shelter, feed, grow, and reproduce on or in another organism, while not supporting the survival needs of that organism. Unlike other small organisms, parasites must have a host organism to survive. There are 3 main classes of parasites in humans that can cause a disease: helminths and protozoa. Humans can acquire internal parasites by eating not properly cooked fish or meat, by being in contact with the carrier of the infection, or by touching contaminated surfaces. Remember, micropigmentation professionals are not allowed to treat or recommend treatments for any diseases. Instead, they must refer the client to a physician. A dermapigmentation procedure can lead to bleeding or to a discharge of bodily fluids. The professional may touch the area with gloves and then transfer to other objects, contaminating them. Unless proper decontamination takes place after the procedure, the next client can be infected by one of the microorganisms we discussed today. In order to keep you and your clients safe, you must learn and practice principles of disease prevention, learn the steps that you should take if there was a spill of body fluids in your studio, and learn universal standard precautions and principles of a safe procedure. To summarize what I talked about today. There are 4 types of microorganisms: viruses, fungi, bacteria, and parasites. Each one of those types causes diseases and/or infections. Today I went over some common infections and how they can be spread. Some of your clients can be infected with communicable and fatal infections and not even know it. Fortunately, there are easy preventative measures that, if followed, will keep you and your customers safe.